I cannot express how difficult this news has been to hear.
BC's provincial health officer got emotional at her briefing in Victoria Thursday afternoon. As she updated the province on the latest information about COVID-19, Dr. Bonnie Henry also addressed a significant spike in overdose deaths in BC. 170 people died from an illicit drug overdose in May, marking the highest number ever recorded in a single month in the province.
My thoughts and condolences go out to the families and friends of those who have lost their loved ones.
The latest overdose numbers mean that more British Columbians have died of overdoses in 1 month than those who have died due to COVID-19 all year.
What we do know about these recent deaths is that there has been a dramatic increase in the toxicity of the street drug supply here in British Columbia, and it is around the province.
The Canadian Drug Policy Coalition says Canadians will continue dying if changes are not made.
Not one of those deaths have taken place in a site that is where people are supervised. So jurisdictions need to be scaling up these kinds of services. So there is just so much we could do across the board, from providing substances by providing safer spaces for people to use substances, by taking a much more robust public health approach to contacting people who are at severe risk of overdose. We're not doing enough on any one of those fronts.
According to the report, most drug overdoses are happening in Vancouver, Surrey, and Victoria. McPherson believes that the COVID-19 pandemic is also to blame.
The minute the U.S.-Canada border was closed, we got anecdotal reports that the drug supply is changing. And sure enough, if you look at the coroner's report from BC, more extreme levels of fentanyl are being found in people's bodies.
In March, the provincial government announced a plan to offer a safe supply of prescription drugs to substance users during the COVID-19 pandemic. Dr. Bonnie Henry acknowledged the pandemic has taken a toll on drug users.
COVID-19 is forcing all of us to stay farther apart from others. And this can be very isolating for some people, and it makes it more able for them to hide their drug use from others, even if they might otherwise have reached out for help or been very careful about not using alone. We know that using alone right now is exceedingly deadly.
In Vancouver, Miranda Fatour, City News.